presentation is by Chethan Anand from Cisco. Chethan is Senior Product Manager and he has a lot of experience in solutions, so he is going to help us for the solution.
Excuse me. Good afternoon, everyone. I am Chethan Anand, Product Manager in Cisco Systems, looking at all the experience solutions and now focusing on the healthcare vertical. It gives me great pleasure to be talking in front of a very esteemed audience here, AIMS audience, all the healthcare experts. So we are getting into this space. So there are a lot of challenges and trends in the healthcare industry. If you talk about from the IT perspective, then things like cloud. How do I put my applications in the cloud? I think Mr. Kapil Mehta was mentioning of how you can take and put everything on the cloud so that patients can access it. So it's some of the challenges that is facing, right? How do you take everything onto the cloud? It can be a private cloud, public cloud, hybrid cloud, and so on. And other things are mobility. Everyone has got a mobile device now, and also about mobility itself. How do you answer that? And data center, virtualization, and so on. So a lot of trends and challenges that you need to address. So what we have seen as part of our research and studies is that there's another big trend that is catching up, which is patient satisfaction and patient experience. So if you do the research and find out, there is a lot of things which say that the number one priority for all the healthcare providers is patient experience now. So why is it a big trend, and what are the challenges out here? So patients are becoming, there's a lot of consumerization happening in the healthcare vertical as well. So previously we used to have a doctor refer the patient to the hospital and the patient would get admitted. But right now it is, people look at friends, family, and also social media and various places, understanding where they want to go and get themselves admitted. So that is another important trend is catching up. And for the hospital, for the providers, it is, how do I provide all these things with the constrained resources I have? You don't have an unlimited budget to provide all these things. So how do you still manage and improve your patient experience in the hospital? And for the hospital, it is more about focusing on the outcomes and less about technology itself, because your more focus is on healthcare. So when I say outcome, it is how do I improve my patient experience? Not worrying about what do I need to deploy to improve that. So what we do from Cisco is look at outcomes-based solutions. So we can say that you're interested in improving the patient experience. So we can provide this, and there's a measure that you can do over a period of time to see that your actual patient experience is increasing or improving. So again, this is just a comparison of the various verticals to say that how important patient experience is. So we generally think in hospitality and other industries, the experience is very important for the guest. But in the healthcare industry, patients are much more anxious. So we need to address that. And if you see the importance that is being given today, it is way below. The healthcare comes as number 6 in the overall experience. It's not, the bottom line is it's not well executed today. From the patient's perspective, they are very technology savvy. Everyone has access to the internet now. They do a lot of research even before getting themselves admitted to the hospital. And what also we have seen is that you can improve the overall patient experience in a hospital setting by providing more technology in the patient room. That is by having a lot of things known as interactive patient care kind of applications. You can do it via the bedside terminals, via the TV, and so on, which I'll talk about a little more depth in subsequent slides. So what are the various ways that we can do this? What are the different services that we can do to address this? So one is, we know that there's a patient in the hospital. It can be outpatients, it can be inpatients, and so on. So how do we address the whole continuum of the services that we do in a hospital? So when we talk about continuum of services, we have outpatients, and then we have visitors coming into the hospital, then we have the inpatients. So what we have found is the various ways to alleviate or the patient anxiety is doing all these things, which is, for the outpatients, we can think about outpatients and visitors coming into the hospital. There are a lot of services that we can provide in terms of once they come into the hospital itself, you can identify that someone has walked into your hospital. It can be a visitor, it can be a repeated recurring patient who's just coming in, or it can be an outpatient. So the first and foremost thing is in a large hospital like this, in a large campus like this, how do you find your way itself to the hospital? Where do I park to start with? Where do I find the different departments? I have an appointment which is 15 minutes, so I don't want to waste much time. I need to get to my department. How do I do that? So you can start pushing services to the visitors and the outpatients. And you can also provide various other services. I think Mr. Kapil was mentioning that there are a lot of people crowding in certain places. How can you start providing services to the visitors themselves, but they can start taking care of themselves and not always rushing to common places in the hospital? So things like, you can schedule something, you can schedule appointments, and you also find that, I have schedule which is only 2 hours from now. Then how do you provide other kind of services? You want to find yourself to the pharmacy, you want to buy medicines, or you want to go to the cafeteria, and so on. So you can start providing additional services to the patients and also inform them 15 minutes prior to the appointment that, hey, you have an appointment coming up, so you come to the, the respective department. Other things that we've also found is from the patient perspective is how to educate. They're very anxious. The patients are very anxious in the hospital environment. So the only way is how do you empower them and how do you engage the patients and how do you provide more information. We can do this by providing much more education to the parents. So they've been diagnosed with a particular disease. So educate them more about the disease, provide videos and other information that is available to them. And also I think discharge process, how we can streamline discharge process. A lot of time, the patients also have to be engaged in the hospital. We provide entertainment. Entertainment here is in forms of the IPTV that we can bring in. So I will show you the solution, how it looks like, this particular solution. So we have a single endpoint in the patient room that we can transform and provide all these services. So you don't have to have disparate systems. And there are a lot of technologies that is available in different systems, IT systems in the hospital. How do you merge everything and make it integrated so that you have one access, seamless access into the system? And yeah, collaboration is another big thing. How do you provide collaboration to the patients, to the doctors, to the nurses, and if the hospital policies also allow, how you can call home friends and family. So we spoke about a lot of challenges and how we can address them. So how is this even done, right? Because there are a lot of technologies out here. There are a lot of services that you can provide. And after some time, you'll start seeing that you'll start having very disparate systems. Then the next challenge is, how do you bring in all the systems together? So we do this by having a common network known as the medical grade network. This is the foundational layer to start building all the services on top of this. So once you have the medical grade network, you can add on various services like allowing to have video services on top of this. You can deploy video services, audio, video. With that, you can have connectivity between doctors. You can have connectivity between different AM centers that you have, and so on. So the primary one is the medical grade network. I think Mr. Preeti also was speaking earlier about how the files get destroyed. So you can also put everything in a data center, and then we also have disaster recovery so that if anything happens to that particular data center, it is even backed up in different places. So I spoke about continuum of services that you can provide in a hospital environment. So people can walk in to the hospital, so you can have mobile devices, identify the mobile devices, and then start providing services on that. If they don't have mobile services, then you can have kiosks deployed in various places in the hospital. People can go and self-serve, use at kiosks. You can register in the kiosk, you can find your way, and so on. And you also have common areas in the hospital like waiting rooms. So you can provide, if you have an ortho clinic and you have a waiting room over there, and you have a new equipment which is coming into your ortho department, you want to showcase that to the patients and say that, hey, you can utilize these services going forward. You can even start showcasing that over there. And in the patient room, which I will delve into more details, and mobile, definitely it is something that everyone has to address today because a lot of people have mobile phones. So you need to start providing all the services on the mobile phones that you can provide on the wireless network. This is how typically you can provide all the services inside the patient room. They already have TVs existing in the patient room. So what we do is use that TV to transform it and provide all the services. Services, be it education, information, entertainment, collaboration, and so on, all these things. So different ways that you can connect to the system. You can use it over the remote, bring your own device that you need to support. Another challenge that IT is facing, right? People walk in with their devices and you need to be part of the network. You need to administrate and manage it and provide all the services on that device. So you can bring your own device and control these endpoints. You can even using it with the remote or special medical grade devices like a pillow speaker. So this is a glimpse of what the application is. We also have a booth right over here, so the whole application is being demonstrated. You can feel free to walk into our booth where we can showcase you the solution. So once the patient is admitted, we provide very personalized services to the patient, understand where they are, what have they've been diagnosed with, and provide specific educational videos to them. We understand the condition. If they have diabetes, show the diabetic videos, and also we provide the control for the nurses where they can administer what the patient is doing, and also they can push more relevant videos. They have been diagnosed with diabetes, but they also have a cardio issue. So you can see that, okay, these videos are relevant to this patient, and push those videos to the patient. So what we're also doing as part of all these things from the patient perspective, so there are many actors in the system. So one is the patients, the users of the system, and the clinicians, the nurses who are providing care to these. So we also want to improve the efficiency of the nurses. So instead of just answering all the administrative tasks for the patient, you can focus more on the care, and most of it is automated in the system. So the patient wants to talk to the nurse for some specific need, you can call the nurse using the audio video system. You want to call the doctor for some emergency, you can actually, the nurse can patch the doctor. You also want to call a doctor who is in other facility of your aims in different center, then you can even bring in that doctor for consultation. So you can do all that in one system. And I think I was also mentioning about the various IT systems that exist in the hospital. For the patient, it's all one integrated system. You have nutrition that you want to order food, you can do that. If the hospital administers food, then you can show what is the menu for the patient. Then you also have pharmacy. You prescribe something to the patient. The patient really wants to know what are the side effects of this. They can go and look at that. They can even have messages with the nurse, requests, my AC is not working well, and so on. So instead of calling the nurse and a nurse coming into your department all the time, you can just send a message to the nurse, and the nurse can answer that. You can even have a lot of things which is happening in India today, like medical tourism, right? And you have people coming in from a lot of different countries speaking different languages. Even in India, you have people with different languages. So how do you address that? You can also provide a service where they can call to a call center where you can take care of all their translation requests. So these are the various flows in the system, and we can customize all the flows because every hospital is different. Every hospital has a different need, so we can customize all that. We also show all the care team, and this is the collaboration part of it. From your hospital bed, you can feel free to call the nurse, and if required, you can even patch the doctor. The doctor can come in. I think I was mentioning some more use cases wherein the doctor walks in, they have access to the PAC system. Doctor is given a particular device to access the PACs. So you can use that. You can just share it on the screen, and then you can share that image and explain it to the patient of what their condition is and what they've been diagnosed with and so on. This is how the nurse has got access to the system. So the nurse has been assigned certain set of patients. So the nurse has access to exactly what is happening to the patients when they have been admitted, what are the requests coming in. If they've gone through major surgery, then you can send short surveys like pain score, what is your pain level. If it is too high, then they need to be looked at. And you can also start looking at when is your discharge time and monitor that. These are the various ways that you can access the system. From the hospital itself, from the admin perspective, you can control of what surveys you can give to the patients, because you don't want to wait till the end to know what their experience was in the hospital. So you want to get a timely feedback, so you can do that. And these are the various ways that you can interact with the system. This is the way, the kiosk that you can lay out in the hospital, and this is the wayfinding that you can do. This is a static wayfinding, which shows you the way that to a department. You can also do a dynamic wayfinding on your mobile device, just like how you can see Google Maps. You want to go to a particular department, actually it will show you how to walk to that department. This is the waiting room scenarios. So we spoke about a lot of stuff that is possible to be done, and we can start building it in phases and providing more services. So we also have a way in which we can help build it out. We can understand all the business needs that you have, and then come out with the blueprint of how it can be layered out and then built, starting with the medical grade network. And then we also build it for our customers, and we help them manage the whole network as well. And why Cisco? We have a lot of customers worldwide. and 80% of all the hospitals worldwide use the Cisco infrastructure and network. So we have been in this business for a long time now. So that is in summary of, we have a plethora of solutions that we can provide. This is a glimpse of what we are looking at right now, just to give a peek of the patient experience and what is being done in that area. We have other solutions also that can be built on this network, on the medical grade network, like virtual patient observation. You have patients in ICUs or different beds that you want to monitor from one place. You can build video analytics onto that, saying that if the patient moves, then I need to be alerted instead of monitoring them all the time. Then we have extended care, where you can connect different hospitals, you can bring it to remote areas, you can connect different endpoints, and also do remote consultations. So let me stop here, and we also have Rajesh with me. So if you have any queries, we could answer that.
Thank you, Mr. Chethan.
Thank you.
I would like to invite Mr. Kapil Mehrotra to present the token of appreciation to Mr. Chethan Anand. Thank you, sir.